Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, here to give you an update on COVID-19 across the country, in Maryland, and here at GBMC. So I think everyone knows we're having another surge. This surge is not as big as the last surge we had with Omicron, but it is creating disease in the population. Our test positivity rate is now 8.5%, and it's a bit awkward giving that number because we now know that many Americans are testing at home and we don't get access to those data. We only have access to the data for people who are being tested generally with a PCR test at a testing center. But at any rate, we know that we had been down as low as 2% positive, and now we're back up to 8.5% positive. The good news is that this mutant of the virus is not creating a lot of very sick people. Why is that? Well, part of it might be the mutant itself. Part of it is that many people have immunity because they got Omicron, and a large part of it is because of the people who got immunized. So again, thank you for staying up with your immunizations. In Maryland, there are now 480 people in Maryland hospitals, which is many fewer than back in January during Omicron. At GBMC, we have 15 inpatients in the hospital who are COVID-19 positive, only one in the intensive care unit, and no patient is requiring the help of a ventilator. So again, this is underlining the fact that yes, there are people in the community acquiring the virus, people getting coughs, colds, sore throats. Very few of them are getting sick enough to make it into the hospital, and even fewer are sick enough to need the intensive care unit. At GBMC, we have had one death from COVID since April 1st, and that is another marker for the fact that we are not seeing the ravages of the virus at this point. So we need to once again remind people that the vaccine was created to keep people from getting really sick. It was not created to stop people from getting infected. So please, if you meet the CDC requirement for a second booster, they have now been authorized for everyone 50 years of age and older and everyone who is immunocompromised. If you fit into an eligible category, please get your second booster. Boosters are also now approved for children ages 5 to 11, and 15,000 children in the country have been hospitalized in that age group of 5 to 11 with COVID. So please take advantage of the vaccine if you have a child in that age range. And also, please make sure that you keep your children up to date with their other immunizations. This is, as a pediatrician, I feel very strongly about this point. Parents let their guard down when we don't see the disease. It gives you the false message that the vaccine is not required. Precisely the reason why you don't see the disease is because the population has been immunized. We cannot forget that. If parents start taking a maybe my children don't need these vaccines attitude, those diseases will come back. So please keep your children up to date with their immunizations. There's another point that we should be making, and that is the availability of Paxlovid, which is a medication that has been shown if you take it early on in your disease with COVID-19, it will shorten your disease symptomatology and will also give you added protection against getting seriously ill. So elders and people with immunocompromise in particular should be aware now that if we catch the disease early in its progression, so please notify your healthcare provider if you are sick and you're testing positive, because we want to give you this medication to give you even more protection against being seriously ill. As we head into the Memorial Day weekend, I hope we have great weather. I hope we can all enjoy ourselves. Let's remember the common sense things. If you're going to be in with a lot of people, especially if you're going to be indoors, you may want to consider wearing a mask because, again, masks will reduce the probability of you spreading a viral pathogen from yourself to somebody else, and the mask will also give you some protection against acquiring the virus from somebody who has it that you come across. Tests are readily available. You can now buy the antigen tests, which are the best ones for quick, rapid use to see if you are positive with COVID-19. Always remember to wash your hands, and thank you for talking up the importance of vaccination and boosters. So I want to again thank everyone in the community for what you are doing. The hospitals right now, we have a lot of sick people in our hospitals, but not many from COVID, and it's in large part because of all the great work by people in the community following the evidence to keep themselves and others healthy. And of course, I need to thank healthcare workers who continue to stand up against COVID-19 and all other diseases for that matter, and a particular shout out to nurses. We had National Nurses Week in this month, and it is National Nurses Month. I know just about everybody knows a nurse. Please thank him or her for their service. Have a great Memorial Day weekend, and we'll speak with you soon.